Good morning. Welcome to this first session of Managing Quality in Health and Social Care. The unit is number 5. The unit level is number 5. And in this document, I hope you can see my screen. It shows the learning outcomes for the learners. By the way, I'm Dr. Anita Khoso, and I welcome you to this session today. And just, yeah, so we passed 1 minute. So the learning outcomes will be, for the learner would be to understand the differing perspectives of quality in relation to health and social care services. So we're focusing mainly on health and social care services. And yeah, and understanding this LO2 will comprise of understanding the strategies in order to achieve quality in health and social care services. And the third will be to be able to evaluate systems, policies, and procedures in health and social care services, understanding methods or methodologies for evaluation of health and social care services quality. So how is the quality assessed? So there's some indicative content that you should be able to go through, and it is again related to all the learning objectives that I have so far discussed with you. Sorry. So I'll stop sharing my screen. And if there are any questions, please do not hesitate to ask me. I'll share my screen for the presentation. So yeah, we're talking about managing quality in health and social care. So what do we mean by these terms? We'll be going and understanding a bit about what these terms mean. And we'll be covering the first learning objective that I mentioned, that is to understand differing perspectives of quality in relation to health and social care services. So as I said, what does quality mean for a person who's visiting a healthcare provider? What does quality mean to that healthcare provider, and what does quality mean to that person who's visiting that healthcare provider? So they're different perspectives seen through different lenses, and they're all to do with health and social care services. So we'll go and understand what these perspectives are. So the indicative content for this learning objective would be to understand, for this first learning objective would be to understand what inspection bodies are there with regards to quality. We'll talk about what are the different stakeholders. So we'll talk about staff members, we'll talk about service users who are using the service. They could be obviously there, the patients and the people in the community, care professionals and their managers. So these are all the stakeholders who are directly or indirectly related to health and social care services. Then perspectives on quality. So we'll talk about what perspectives are there existing within the external bodies, different external bodies. We'll talk about what are the quality standards and quality measurement ways, how to measure quality, quality control, and quality assurance. So quality needs to be maintained, definitely. This is, and if you achieve that level of quality, you need to make sure that it's maintained at a higher level, or at least at that level and not below that, obviously. And that comes from different strategies. We'll talk about how those are done. external agencies that are responsible for setting standards in the country, and the UK agencies, which should include Care Quality Commission, National Institute for Clinical Excellence, Social Care Institute for Excellence, Health Services Commissioners, local authorities like the council, etc., and charities which are working within the UK. And what's the impact when with regards to quality and quality improvement, and what if objectives are not achieved? So we'll just have a look at this video. Just a minute. I'm just setting up the video. It will take a minute. Oh, yeah, this screen is shared. I hope you can see the screen.
Effective, so you accurately diagnosed and receive treatment that works. Safe, so the
Okay, that's for this. Just a minute. I'll share the presentation with you again. Please give me. Yeah, sorry for that. I'll just share my screen again with you. Yeah. So we just watched a video where we talked about a very important subject that is quality of care. So as we saw that many people, they don't have access to quality care. So you might have everything available there, but there's no quality care. So there are more people dying, not because of due to a lack of resources, but because of lack of quality of care. So there's some key terminologies. So, so doing the right thing for the right person for this is and doing it every time. This is what quality means. So the different terminologies that we would talk about. So the patient experience, I hope you can see my screen properly. So patient experience is very important when you're focusing on healthcare delivery. So quality healthcare would not be the same for every patient. Obviously, it's a subjective term also. What the main components of quality care should be they comprise of effectiveness. So the healthcare should be underpinned by deploying beneficial interventions at the right time and to the patients who need it the most. Efficiency, so you have limited resources. Every institute has limited resources. Obviously, those resources should be used properly to the best of their ability and avoid wastage of those resources, and that is what efficiency is about. So use them where they needed the most. Timeliness is very important. Again, if that proper healthcare healthcare provision is not there at that time when it's required, it's of no use. Then it should be safe. As in the video you saw, that it should be safe, that there should be zero tolerance to an unsafe environment. Equity is very important. So we talk about two terms here. Sometimes we use equality and sometimes we use equity. So equity is that you're providing the patients, you're not providing, obviously care is not provided equally to everyone. So there's some people who require it the most and some people who require it the least, and some are intermediate. So you're going to categorize those ways. You have proper measures of categorizing them. It's not something that's subjective. So you feel for someone and then that is why you're caring for them before you're caring for some other person who needs it more. So that's not the way to be done. It should be equitable. There should be standards that should be there in place, and it should be sustainable. So as I said, if you've achieved your quality, that benchmark of quality, that should be sustained throughout your journey of healthcare. So we'll talk about more key terms, some adverse events. So what's an adverse event? So an adverse event is something that is not expected, and it's something that's it's not in the favor of the patient. It could be anything. It could be regards to physical damage, and with regards to mental health components that are affected of that patient. A medical injury, again, could be anything related to any procedure, when that's been applied to the patient, and within that healthcare facility. Preventable adverse events, there's some adverse events that are expected beforehand, and that those can be prevented. So there should be complete focus on to devise ways to prevent those adverse events from happening. Medical errors, they happen, and that's very common. So for instance, there's a patient who's come for a surgery, and that patient's labs are not complete, and that patient is ready for undergoing surgery. Everything is prepared, but the labs, some lab has not prepared. So that those, if you have a proper checklist, that makes your life much easier. Even apart from this, what we're talking about, checklists always help. They always support you, because you're not going to have the same staff always. You're not going to have the same resources always. So it's always better to work with proper guidelines and checklists. Medical negligence, malpractice is something that happens again in both developing and developed countries. So negligence is like a patient who's developed bed sores because of being bedridden, and you were not aware of that fact. And that is why that patient developed bed sores, or any other example could be taken. So, and medical mistakes, again, something like medical errors, very similar, and those can be avoided. A proper strategy should be there to record these medical mistakes so that they could be avoided, and ways could be discussed on how to best avoid these medical mistakes and what the consequences could be. Lapses, again, delays, and they're very common. What do you not have in quality? What should there be, the things that should be there in order to avoid quality deterioration? So safety and security is very important. This is everywhere. It's not just healthcare. It's availability, reliability, security for the patient, for everyone. People who are traveling, they should have clear flight times. They should have a safe environment to travel in, and they should have staff and people available for them who are reliable there, and that feeling of security should be there. Environmental protection, again, talking about different products that are at risk in the hospital. So there's different products that need to be out of reach of the public, so that, let's say, there's radiation, a threat of radiation, let's say, and people only with a certain disease, let's say they're going through chemotherapy, they're going through that radiation therapy, only they're allowed in those So yeah, we were, just share my screen again. Yeah, so what is quality management in healthcare? So in healthcare quality management, it refers to the administration of system designs and different policies, processes, and these are there in order to, first of all, eliminate harm. And if they do not eliminate harm, if they're not able to eliminate harm, quality management in healthcare should minimize harm and increase patient care and make the outcomes better. So what is your, so your design, your policies, your processes, all should be in line with quality. So quality should be an integral component of all of these procedures. Why quality management is important? Uh, it should be the goal of every healthcare provider, and this is to reduce costs, because if you're treating a patient and you're not providing the quality of care, the patient will come again and again and again. So you're just wasting your resources thinking that you're providing care, but it's the other way around. And it's the same for any other organization and patients. So the three main components of quality healthcare are effectiveness, so providing evidence-based healthcare services and providing them to those who need them. So equity comes in that. And then it should be a safe provision of healthcare, and this is to avoid harm to people. And providing them the best of care again. And then everything, whatever you do, should be people-centered. It should be, if you're treating patients, it should be patient-centered. So you're providing care and it responds to individual preferences, needs, and values. That doesn't mean that you're going to depend on the patient's views and their demands and their ideas. Definitely those should be taken into account, but those would not be you could change your case. So for instance, if there's a particular patient who wants antibiotics for his viral infection that you're suspecting is a viral infection, and those antibiotics should not be used in that patient. So that patient would have to be then effectively advised on why those antibiotics, he or she is not the proper candidate for those antibiotics, and that you would be using antivirals, and why would you be using antivirals. So when you're keeping it patient-centered or people-centered, you're then talking about their preferences, what they need. So they come from different backgrounds, they have different thoughts, different views. Those have to be respected every time, not putting your views first, listening to them, and then doing what is best for them. So what quality means to stakeholders? We talked about different stakeholders. So the quality perspective is the major concerning area for all stakeholders. And this leads towards customer satisfaction. So who's your customer? It's your patients, it's your people, leaving a positive impact. So they'll come again and they'll want to interact with you again. So this should be your ultimate objective. So for instance, if you're seeing patients or like you're seeing in 10 minutes time, you're seeing, let's say you're seeing 2 patients, you're giving 5 minutes to each patient. If you're not maintaining the quality, there's no point, even if you go faster or slower. So your main objective should be quality, even if you're giving that patient. I know it's not possible always. You have limited resources. That means you have limited time also. Time is a very important resource. But having said that, if you're letting a patient go unsatisfied, you won't get that patient again. You won't be able to treat them properly. So quality should be there, which should be your ultimate objective. Health sector, what are the services in health sector? So requirements of quality management, they have to be interpreted differently compared to this, other industries and other types of businesses. So you're involved in other, obviously, there are different stakeholders. So we are talking about healthcare services where we have patients as our main stakeholders. So the first reason is that health services, they're characterized by physical and mental involvement of patients. So it's more delicate. It's provision of care, and it's a continuous interaction between the healthcare professionals. And in businesses, you might not have it as a continuous process, and you don't have physical and mental involvement. The second reason is that customers have very little knowledge of the professional aspects of the services that are delivered, and the relationship between the patient and the professional, it's an unequal one. And this is considering the professional input. And choices will be highly influenced by the professional. Obviously, yeah, you will do what is in the best interest of the patient, but the patient might not know entirely what the problem is that they are facing and what are the consequences. You're seeing the prognosis. Obviously, if you're a healthcare professional, you're seeing what's going to happen. You're predicting what's going to happen in the future. So you want to avoid those adverse events, and for that you're giving something that the patient might not like, might not agree with, but then you have to do what is in the best interest of the patient. And then reason 3 is commonly purchase and receipt of health services are separated. So there's a third-party payment where you are the provider. You may have to satisfy different quality demands and from the two customers that are the patient and the purchaser. So this doesn't exist in businesses, obviously, and other industries. So when you're receiving or purchasing health services, there are different criteria involved in them. So the people who are purchasing healthcare services are different compared to those who are receiving them. So there's a third-party payment, as I said, and whoever is providing that healthcare and have to be at that level of providing the best quality of care for that amount of service that is being purchased. So you're explaining the perspectives that the stakeholders in health and social care have regarding quality. So there are different stakeholders we talked about. So what are the different stakeholders? What are their opinions about quality? So quality perspective, it's the major concerning area. It leads towards customer satisfaction. So you're putting a positive impact on the stakeholder. It should be ultimate for all the companies that are involved. Stakeholders in health services are the service users. So who's using the services? They're the patients who come to you or in the community. So quality to the service users means any service which is offered to their satisfaction. So for instance, it should not only be comprising of provision of medicine. For instance, if you're giving just respect, so it is so important to any service user. So let's say there are people who want to be addressed as Mr. or Mrs. This should be their choice, and you need to find out what do they want, how do they want to be addressed. So this is something that is so small, but it is so important. While you're offering personal care, so you're bathing a person or you're washing them, you should ask if they need a chaperone with them. And for dignity purposes, you need to ask them if they could, if they want the curtains closed or the door shut, they need more privacy. So every person, regardless of whether they are old or young, they need their own privacy, they need to be respected. So if you're giving everything and you're not respecting them, it's of no use. So that quality component is not there, and it's of no use then. Choice again. the different choices. Now, the patient can't make choices for their medication, obviously. They can make a choice, like they could go for a drug that can be taken. So a drug that's obviously in a tablet form would be more effective for an adult compared to, obviously, tablets cannot be taken by younger children. So a younger child would obviously not opt for a tablet, but if they do, you're not going to give it to them, is it? Is you're not, obviously they're going to choke upon it. So, and for an adult, if they say that they have a tendency of choking upon tablets, you would then go and respect their choice and go for some other option where they can easily ingest that medication. So this is putting their choice also into consideration. Not entirely, obviously, but then you have choice of menu, you have foods and drinks, you have different dresses if they're bedridden patients or they're admitted, activities in which they would like to participate, and seeing that they're happy with the services and they're satisfied. And then confidentiality is very important. So let's say there's a person who doesn't want to share some information with with anyone. They're suffering from terminal illness, let's say, and there's a person who comes to you and asks you about the next of kin, the daughter of that patient, or any very closely related person comes to you and asks you about the diagnosis, about anything about it, and if the patient wants it to remain confidential, you are not in any circumstances going to share that information. So it's private and confidential for medical reasons. And it is very important to observe confidentiality of all the data that has been shared. Family and friends, they usually appreciate when they're involved in care plans, that they should be a part of it. And when they're a part of it, they are stakeholders as well, do not forget. So they'll be more involved in the quality, in care and provision of care if they're more satisfied. And then comes safety. So the care that you are providing needs to be safe at all times. So that is one very important component of quality of care. So service users and their families and friends, they're always appreciative and supportive when they know that the patients are in safe hands, and whatever care is being provided, it's in their best interest, and they're safe from all sorts of harms. And they like their relatives, the patients, they like their relatives to be treated equally like other residents, and avoiding discrimination based on all factors. So, and then we talked about the service users, which were the patients, then the carers. There are different care homes, there are different people who are involved in care homes. So what are the factors that influence quality here? It's again equity, as I said. The service provision should be equitable. It should be regardless of age, gender. It should be equitable, so everyone has the same opportunity to healthcare based on what their seriousness is. So and then safety. So we've talked about safety again. So it's there should be environmental safety for the residents, their relatives, for them, for the patients themselves, and anyone who's concerned. And then so there should be proper mobility aids if they're required, and everything should be foolproof, and it should be safe, a safe environment for those patients and their carers, whoever they are around them. Carers are always happy when they're not abused. And by abuse, I mean even being neglected comes under the category of being abused. Perspective of technicians. So there should be effective performance of the Royal United Bath NHS Trust. It depends on technical services. There's a term called total quality management, which is called TQM. This is a system where the whole working staff of the organization maintain their basic objective is to maintain high quality standards at all times. Other aspects could be you could use auditing, you could use recording of data, you could use different feedback mechanisms from different stakeholders. They are there to provide you measures of total quality management. And analyzing the role of external agencies in setting standards. So there are different agencies we talked about. We'll talk about in detail, a bit of detail about these, each one of these. So the Care Quality Commission, this is one of the first that we'll talk about. So it's an independent regulator of health and social care in England. And these are there to regulate care provided by the NHS, different authorities that are working locally, private companies, and voluntary organizations. Their basic aim is to make sure that there's better care. Sorry, can you mute yourself, please? Thank you. So the aim is to make sure that better health is provided to everyone. So this Care Quality Commission, CQC, it makes sure that whatever the service users are involved, they're heard and they're asked about their experiences for the care services that have been provided to them. And this makes sure that users' views are at the center of all whatever activities are there, are happening there. So the CQC takes actions if providers do not meet essential quality standards. So for instance, if there's negative feedback coming from patients, and it's not once, it's not twice, it's on a constant basis, then they take measures in order to understand what's the reason and why is this happening, and if there are serious risks involved, and that has led to serious consequences. There could be fines, there could be termination of jobs, etc. So this is there in place. NICE is National Institute for Health and Clinical Excellence. This is an independent organization which is responsible mainly for providing national guidance in order to provide a good health and preventing and treating ill health. So there are different guidelines that provide training on different medical conditions. For instance, if there's diabetic foot, how would you identify it? How would you diagnose it? And how would you treat it? And other conditions like anxiety, panic attacks, use of sedatives, all of these guidelines are there in the NICE 2010 that works towards improvement in quality of care for patients. Then we come to Social Care Institute for Excellence. This is also, again, an independent organization that was established in 2001. This was a part of the government strategy in order to improve social care provision and practice. There's a Department of Health and this Social Care Institute of Excellence. They have service level agreement, and this defines the objectives of the funding provided by these two organizations. So it provides some useful information. There's a lot of research also that goes into it, and there are different examples where good practices have been shared, and they have developed guidelines and proposals for further research also. So this institute is it's a leading it leads in values-driven improvement agency. And recently, it has evolved from a largely government-funded body to a fast-moving, high-profile, more commercial organization. And it says, obviously, it's people focus. That is why it's working so well, and it shares what has worked there. So it shares good practices and in all the sectors involved. And then we have the health service commissioners. So we have commissioners for healthcare audit and inspection. This healthcare commission, it was established in 2004, and it also is responsible for assessing standards of care provided by the National Health Services, and its responsibilities have been taken over by the Care Quality Commission, which is CQC we've just talked about. In 2009, we talked about how CQC works and what are its main objectives, keeping everything people-centered and quality being the main core value. Local authorities, these represent the local communities. So for instance, we have the councils working locally, so they make important decisions. This is for services and the council's priorities. And they provide community leadership. A local authority has to be established and should be maintained as a service for providing people with information and advice relating to care. It's support for carers, support for adults. So this should be there as an integral component. And how to raise concerns about the safety or well-being of an adult who has needs for care and support. So every adult would not need care and support, but those who do need it, how do you, they have ways of raising concerns. So let's say the place where they live, the house that they live, that's not appropriate for them to live in. So the council then provides, they have, obviously they provide the ways in which harm could be minimized and quality of care would be provided at the best. And the 6 key elements to build a whole council approach to improving health. We'll talk a bit about these 6 components. So there's local leadership, they're elected members. They again, they're champions of the causes. They work across parties, so they have different stakeholders who are involved, and they drive the whole and all the activities of the council. And they come up with issues, and they have elected members who are very strategic in their thoughts, and they're influential in what they do, and they then come up with solutions to those problems or those issues. Whole council focus and strategy, the second element. All directors, they understand their contribution, which is there to improve health, and that is not the sole purview of the Director of Public Health. So public health, it acts as a strategic service within the council. It's involved in shaping strategies, and they provide data and intelligence, design evaluation criteria, and define outcomes from the outset. And this is for all the key projects that are involved. And then the third element is key partnerships. So there are different partnerships that are built, and those are actually, again, to provide healthcare quality healthcare. They may involve local businesses, voluntary and involuntary services, and local delivery partners, which include health organizations. So these partnerships are there in place, which is one of the key components. Community collaboration, without which it's not possible. So there are solutions that are designed in order to meet the needs of local people. So then when you're electing a person, which is a part of the community. This should be the ideal case. If not, then that person doesn't know the community dynamics very well. These need to be there in place. And if they're not, obviously, then you don't have the say from the community. And then the diverse voices that should be heard. So every voice needs to be heard. And this is again, and they should know that there is a collaborative effort there so that they can provide their best of input. to different solutions. Problems, obviously, there are different problems that arise, and their solutions could only be addressed when you're working in collaboration. Then there comes evidence-based communications. This is to build support among different stakeholders. So you have different partners involved and they communicate in different ways. This builds an understanding about complex and systemic causes of ill health. And this is to build support from all the sectors. And their ultimate goal should be to improve the quality of healthcare. And then we come to the last aspect, which is evidence to inspire action. So there should be evidence that is accurate and timely, and this should be there to share, inform others, and then to inspire others to work towards the betterment of health and healthcare. So there are national networks that are maintained and developed, and these resources and expertise from academic institutes, they're explored and accessed by these services. And then we come to the component of assessing the impact of poor service quality on health and social care stakeholders. So we touched upon this a bit initially in one of the initial slides. So if there's failure to sustain quality, it affects the stakeholders. This is at every level. And this is not just the patients themselves, but it also involves the employees and the others who are involved. So it may be customers like family members of this service users, or family members of the patients who would also be impacted, obviously. Employees or care staff, they directly face the anger and stress of service users. So this makes a problem in creating healthy working environment. So there should be ways where the service users need to make sure that there should be mutual understanding and mutual respect. So respect comes from both sides. This is in order to make it a better environment for the employees who are, or the care staff also, who are obviously burnt out, who are obviously working to the best of their abilities, and who obviously cannot work in such environments then. The stress of carers, this is because of arguments and complaints is always there. Service users might feel demotivated at times. So what is it that you do to motivate them? Always make sure bonuses and making them aware of what they're doing right, not focusing too much on what they've done wrong, but there should be a mixture of both focuses. So these are some ways where you can think of motivating your staff. And recovery period is elongated. Sometimes reputation of the service home is compromised. So sometimes when care is not provided, quality care is not provided, obviously the patient suffers, because of which the whole service suffers along with the employees. So that the reputation of that care service needs to be maintained. As I said, it needs to be if there's development, that it should be sustainable. So for the different perspectives on quality, so there's quality, total quality management, continuous quality improvement, which is called CQI, quality standards, and different quality cycles. So these are some things that we will discuss further in detail. I'm not sure who's in. Oh, it's Placidia. How are you doing, Placidia? I hope you're okay. Yeah, Placidia. So if you go through this presentation.
Oh, I'm fine. I'm sorry for the delay. I'm fine. Thank you.
That's okay. No, that's okay. I'm just saying that because of time constraints, we would not be able to completely cover these perspectives on quality. So what you can do, if you can just take a screenshot of these 4 components, and then we can discuss them tomorrow, if that's okay. So if you've come with an understanding of what these are, we can then talk about these and discuss these in detail tomorrow when you join the class.
Okay, ma'am.
Yeah. So it's quality
Yes, ma'am.
care, total quality management, continuous quality improvement, CQI quality standards, and quality cycles that we'll talk about. So just talking about legislation, so there are certain laws and rules in place. These are by the government on how provision of care should be. And this is like, for example, you have protection of vulnerable adults. So this is the legislation is there in which you protect all residents from any abuse. So negligence, again, as I said, is a form of abuse. So there are different forms of abuse that you should be aware of. Even providing unequal care, that is a form of negligence, and that is obviously a form of abuse. So there should be mandatory trainings attended by people who are involved in safeguarding vulnerable adults. This is according to the regulations of CQC. We'll talk in detail about it. Safety should be there. So obviously, we talked about safety, one of the key elements. Risk assessment should be carried out. Again, there should be a checklist that should be developed on every service user, and measures should be there in place. You could use bed rails in order to prevent falls. So this is all research based. So when you know that research has shown what are the most frequent reasons for falls in service users, just simple research could tell you that there what can be the 5 or 6 main factors. So you might not be able to work on all of them all together, but you can work on just 1 or 2 components just to start with it, and then build upon those findings and talk about new problems and new solutions. So the quality should be the major component in all instances. So yeah, so and obviously in when they're vulnerable adults, you have to make sure that their safety has not to be compromised. And then coming towards independence, so this is for making them take control over their lives. This is to allow them to do things like simple things that they like doing, tidying their rooms by themselves without with the complete safety that needs to be there in place. So if they're active and if they're working towards improving their lives, it gives them a sense of self-achievement, and they could be supervised in it also, and it makes them happy. And you're providing quality of service and they're satisfied. So the rights of people needs to, every person has their own rights. So and service users, they should continue to enjoy the same rights when they're in nursing home, like they were the rights that they had when they were living independently. So the service users supported in nursing homes, they have a right to say no. They have a right to relationship. They have a right to say what should there be in their care plan. Let's say their menus, their dressing, and different aspects. But obviously, those only that should be in their best interest. Obviously, as I mentioned earlier, if they are not happy with some treatment that is being given to them, and that treatment is very important for them, then obviously those factors need to be taken into account, and it is in their best interest that the treatment should be provided in the best interest of these patients. And then service providers always tend to balance service users' rights against their responsibilities, whether both are when they both are at risk or not. So obviously, as I just said, there needs to be balance in how much to allow them to say no, or how much how much do they have a say into their different matters of life. And these are all the references that you could access for this, for the first learning objective. And these are some of the books that you could have. The links are there. Quality of care, you could access this also. If you have any queries, again, this is the website that you need to access. There will be an assignment that will be submitted after 2 weeks. I'm almost done with your assignment checking, so I'll be sending out the results very soon, hopefully, for the previous module. So yeah, this presentation would go online as well, in order to, because obviously for you or for the others who were unable to attend. So any questions, Placidia, otherwise? Yeah, so just have a look at this presentation. It's very explicit and very simple to understand, even if you look at it. And the presentation is obviously going to be shared with you. Any questions, you have the link that's shared with you. Yeah, I'm happy to take any questions if you have them later on, no worries. Okay, so that's it from my side. I will meet you tomorrow, 9 a.m. sharp. Have a nice day then. Take care. Bye.